All right. Can everyone see that? Okay. Is it coming up? Okay. All right. So welcome everybody to this is a PHA Prepare lecture series, and this one specifically is on clinical opportunities. All right. So we're going to start off by introducing ourselves. So I'll go first. My name's Brooke. I'm a senior. I'm pre-physician assistant, and I'm majoring in anthropology and human biology. And my clinical experience has mainly been as a physical therapy technician, and I'm planning on getting some more clinical experience as a medical assistant this spring and in my gap years.
Hi, I'm Izzy. I'm also a senior. I'm a biology major and econ minor on the pre-med track. And my main clinical experience has been as a chief medical scribe at the emergency departments at the Emory hospitals. And I'm planning on getting some more shadowing in. Yeah.
Hi, I'm Sonia. I'm also a senior and I'm on the pre-PA track. I'm studying human health with a German minor. And so far, my clinical experience has been as a volunteer medical assistant at the Harriet Tubman Women's Clinic. I'm currently serving as an EMT volunteer with Emory EMS, and I've worked as like a medical scribe and medical assistant at a dermatology clinic in Sandy Springs. And during my gap years, I'll definitely plan on getting more clinical experience as well.
Hello, everyone. My name is Sneh. I'm also a senior. I'm majoring in neuroscience on the pre-med track, and my main research experience, clinical experience is through being a certified nursing assistant at Harbor Grace Hospice and also being an ABA intern at Marcus Autism Center.
All right, so we'll just give you kind of an overview of what we're going to be talking about. So we're going to be talking about what is clinical experience, why do I need clinical experience, and what should that clinical experience look like? Paid versus volunteer clinical experience, because there are some differences between the two. Different clinical opportunities. There's so many ways to get clinical experience. There really isn't just one path you can go down, which we really want to emphasize. There's just so many different ways, so that no matter what your passions are, you can totally find something. And then we're going to talk a little more in depth about our experiences with clinical experience. And then at the end, we'll have some time for questions.
Okay, so to get started, just like generally defining what clinical experience is, just because like Brooke said, there are just so many ways you can get clinical experience. So we just kind of want to give like an umbrella definition to encapsulate all of that. So out of the clinical experience that you decide to do, it should be able to give you like an inside look into the day in the life of a healthcare professional, and allows you to provide or observe patient care. So this can look very different in a lot of different ways.
So the second big question you may ask is, why do I need to engage in clinical experiences? And I think the answer is there are many reasons for it, but I think it comes down to the main point of being like understanding the healthcare profession that you're getting into. So if you look at, if you look at the stats for most of these pre-health schools, you would see that most students who get admitted have significant clinical experience. And the reason for that is it's going to help you decide if this is a path that you want to go down into, because obviously all these pre-health tracks require additional training and graduate school education, and it's a long process, and you want to make sure that this is what you want to do in the future by following people who are doing it right now, and also, you know, making sure that this is something that you enjoy and something that you would like to do for the rest of your life. So getting exposure to the clinic and all these pre-health settings, understanding that this is the right path for you, and also just learning about different healthcare careers and also the healthcare system. So if you're pre-med, you might want to do different clinical experiences to identify what path you want to go down, what specialty you might like in the future. And if you're pre-PA and other things, you can also, you know, look at different specializations and see if this is what you want to do. So ultimately it comes down to understanding if this is what you want to do in the future, and I guess exploring to a certain extent.
Okay, so I'm going to go into paid versus volunteer experiences. So there's a ton of different paid clinical positions. And as you can see, the four of us have all different types of experiences. And just want to say the clinical experience you choose is enriching to your narrative of like why you want to go down this health track, like what Sneh said. So finding a position that suits your passions and your interests and can just add to you as a future medical professional is really going to be beneficial. And I also wanted to say that different pre-health tracks accept different clinical opportunities. So the ones that I've starred are the ones that are specific to medical schools. So this is the clinical experience that medical schools might like to see. If you're pre-PA, pre-PT, pre-dental, those will look a little differently. And if you have any questions about that at the end, we're more than happy to go into that. But so different types of paid clinical opportunities. We have medical scribe, EMT, or an ER tech. You can do both of those with an EMT certification. Certified nursing assistant or patient care technician. Those are often used interchangeably. Medical assistant, physical therapy technician, optometric technician, behavioral health technician, clinical research assistant, and dental assistant. And those are all positions you can get paid for. So when we go into unpaid and volunteer clinical positions, shadowing is probably the biggest unpaid clinical experience that you're going to want to look into for any pre-health path that you choose to go down. This is pretty universal. If you want to go to medical school, you should look into shadowing physicians. If you want to go to PA school, look into shadowing PAs or physicians, either one. Dental school, dentists, and so on. So shadowing, we could probably do a whole separate lecture just for shadowing and how to gain shadowing experience. But the main way to gain shadowing experience, in my opinion, is to kind of find physicians that you're interested in their field or their publications, or maybe you even have a personal connection, and to reach out to them by email. And it's kind of a daunting task. There's a lot of resources we have at PHA to help you with this, because it can be difficult and very intimidating, but the best way is to reach out and introduce yourself and just express your interest in observing their work. But that clinical experience is definitely required for medical school, if not across the board for all pre-health tracks. And then we have volunteer clinical experience. So you can be a volunteer EMT, hospice volunteer, a volunteer at like a medical center or a hospital. But I will say with this last one, there can be a caveat, because if you volunteer at these medical centers and things like that, you must have a direct role in patient care. It's not really, if your role is more administrative, that would be more of just volunteer experience rather than clinical experience. And now we're going to go into the different clinical opportunities and just how to exactly get involved in them, because it's a really exhaustive list. So kind of having direct ways and direct pathways to go about experiencing these things will hopefully be very helpful for all of you.
Okay, so starting with how to become a scribe. So a medical scribe is basically someone who sits with one doctor for their entire shift, and they do all of the charting and logging and records like patient-physician interactions, the physical exam, basically following the patient's course throughout their time at whatever site that you're at. So the main skill that you really need for scribing is typing speed to keep up with the doctor and what's going on. And then also good multitasking skills. So if you don't already have those, it's a really good way to build those skills. And just to go over how to get started. So there are a couple of different ways. So I'm sure some of you might know there are some pretty big corporations who do, they source scribes to different hospitals. So the main one that a lot of Emory people use is Scribe America. That's the one that I'm a part of. That's the one that the Emory emergency departments and ICUs use. And so if you were thinking about starting scribing through a corporation, you would want to apply a couple months in advance before starting. You would want to plan starting your solos in the clinic. So a couple of considerations to make when you are applying is what kind of site you want to work at. So we listed a few here. So there's the emergency departments, outpatient clinics, urgent care, or nursing scribes. Another really big thing. So a big factor that goes into the interview and application process is your availability. So for outpatient clinics and urgent care, a lot of times they might require more open day availability, like talking like 9 to 5 type beat. Whereas for emergency departments where a lot of undergrads work, it's more flexible. You can have like afternoon shifts, morning shifts, evening shifts. And oh, I see a little question. Can you be a scribe for the summer only? So it honestly depends where you apply through. So the other big caveat about working for a bigger corporation is they do require at least a year-long commitment. So I know that might be a long time. However, it's really beneficial to be involved for that long because you get to meet a lot of different physicians and healthcare workers, get their perspective on the field, and also just to observe different types of like patient care. Doctors approach their patients in different ways, and I mean, they're all good ways too. So it's a really good learning experience to be a part of one clinical experience, not just scribing for that long. But yeah, so if another alternative to applying to a big corporation is doing a little Google search on Indeed or Craigslist to find more local opportunities. So if you're thinking about scribing for a gap year, you could do this back at home. You can do it for Atlanta, and it might give you more options that are outside of just like the Scribe America or Pro Scribe umbrellas. But yeah, I see another question. Do they provide training through the job application, or does it have to be done before we apply for the job? That's a really good question. So training for scribing, at least from Scribe America, which is my best understanding, is you first apply and then they'll put you in free, no cost training. So you start out with classroom training to get a good understanding of what an electronic medical record looks like and what your job would entail, and also some basic medical knowledge. Some people refer to classroom training as like a crash course in medical school, which is not that accurate, but it does represent the amount of knowledge that they give you. And then after that, you do floor specific or site specific training in the clinic to get adjusted to the site specific needs and charting styles. And I have another question about providing a link for Scribe America, which I will put in the chat as soon as I get it, and about the timeline for applications. So you're welcome. So that's why, so the thing about the application process is it can be quite lengthy, as I just described, like that long training timeline. So that's why it's important to plan ahead. Fill out the application, which I'll send in the chat, around 2 months before you want to start your solo scribe before training, before you want to like be working in the clinic alongside doctors, because there are different things that can happen in a corporation that can elongate your training and your application process as well. So that's important to account for if scribing is your priority for clinical experience. But yeah, I'll answer any other questions about scribing at the end.
Okay, so next we're going to talk about some of the steps towards becoming an EMT. So an EMT plays a really important role in a pre-hospital setting. So before a patient reaches a clinical setting like a hospital, you just want to make sure that you are stabilizing the patient's condition and performing any necessary interventions on scene. So, you know, and EMTs respond to a variety of calls that can look like a cardiac arrest, anaphylaxis. Sometimes people even call for like a stub toe, believe it or not. So with being an EMT, you're interacting with kind of a diverse patient population. And then as you're doing a handoff, you're also interacting with a lot of healthcare providers as well, and with a partner or a team, you know, as you're interacting with the patient. So an EMT, again, is going to provide that care, stabilize the patient, communicate with healthcare providers. And oftentimes this involves operating an emergency vehicle and managing patient transport, which is also a very key role in the transport. The transport of the patient is a key role in the patient's care and their timeline. Because a lot of times that time that the patient has on scene, as well as their transport to the hospital, is really important in their care and their health overall. EMTs are also making patient care reports. And so because they're acting as providers, they're making their own reports. So you're logging vitals. Oftentimes there are sets of vitals that are performed every 5 minutes. especially if the patient is not in a stable condition. And in that case, you're keeping a log of that, you're keeping a log of their symptoms, you're going through history questions, asking patients or, any bystanders about, any signs and symptoms, allergies, medications, past medical history, and some of the events leading up to their condition. And again, just performing those necessary interventions as well. So, for a patient in a car wreck, for example, if we're worried about any trauma to their head or their spine, sometimes they're put in a spinal immobilization board. Sometimes, in an emergency that involves performing CPR or giving a patient oxygen. Sometimes that is giving a patient an EpiPen if they're experiencing anaphylaxis. So you're really looking at a kind of variety of potential conditions that can occur and potential emergencies on scene. So in terms of getting started, there are a couple of different ways to go about this. The first step in becoming an EMT is you have to get your basic license first. So there are a variety of courses and formats that are offered, across the country. But every EMT starts with getting their basic license, then you can progress to getting your advanced license. So hence the B for basic, A for advanced. So the difference between those two is an advanced EMT can, perform intraosseous interventions. They can give an IV or start an IV. And perform some other advanced life support measures, whereas a basic EMT cannot perform those functions. But everyone starts with the basic license, and then from there you can also get your paramedic license, which does take some time, but it is kind of a cool thing I think about the profession is that you can start with the basic license and then progress from there. There's also an EMTI for intermediate, but that is also being phased out with time. But, something to note that, you can progress. So especially if you start with that sort of earlier in your pre-health journey, that is kind of cool to be able to have that growth within the field. And so in terms of getting your licensure and then working as an EMT, there are a couple of different ways that you could go about this process. So there are volunteer agencies. Emory EMS or EAMS is an example of an agency that we have on campus, which is really cool. So a lot of students get their EMT license through Emory EMS. So they take the course for 1 year. So the basic course for Emory EMS is around August to about February, I want to say. And at the end of that course, you can then take the National Registry exam, which is required for any EMT license, and then get your state license and then work with Emory EMS. And then they also offer an advanced course. So that's something cool about working with Emory EMS is that you can get your certification while you're on campus and then serve your Emory community, which is really cool. There are also private agencies and then publicly operated agencies. And something cool about working with a volunteer agency like EAMS is that you can get your license and then also work with publicly operated agencies. So there are some students who elect to get their license and then work with AMR or Metro Atlanta, or you could simply work with those agencies. And also some students tend to get their EMT license in their hometown, which is cool as well. You just need to make sure that whichever state that you're working in, that you have a valid state license for that specific state. So there's definitely a lot of different options and the course lengths tend to differ, but once you pass that National Registry exam, you are free to work as an EMT.
All right. So next we'll talk about the nursing assistant position or patient technician or nurse aide. All those are synonymous terms. And so I got my CNA license during my sophomore year, and I started working at a hospice center first during my junior year, and I really enjoyed it. So I'm also open to talking about my experience later. So a CNA essentially provides direct care to patients in hospitals, nursing homes, and home care. I think one of the great things about getting a CNA license is the flexibility that you get to engage in clinical experience in different settings. So initially, I worked at a hospice center. If you'd like, you can work at a cancer center. You can also work at an inpatient or an outpatient place. Excuse me. And you have all those options. And typically, if you get a license, then you're pretty much guaranteed a job because there's always a need for nurse aides and nursing assistants at these facilities. So you commonly work under the supervision of a registered nurse or other medical professionals. So like the place that I worked at had one, I guess 4 lead nurses and then 1 doctor, and we used to work under them. We would always go on rounds, and like they would be the ones telling us how to lead the shift and stuff like that. So some of the responsibilities of a CNA are helping patients with a wide range of basic needs, including like eating, bathing, grooming, mobility, even just companionship at times and stuff like that. So it's, you get to do a lot of interaction and build that really meaningful personal connection. You also get to observe and record patient conditions and vital signs, because the first thing that you do when you start your shift is to go on rounds and take vital signs and present it to the doctor or the nurse to see if there's been any change in the condition, to evaluate what needs to be done. And then you also have additional responsibilities depending on the setting. As I mentioned, depending on if you work at a hospital or a nursing home or a hospice center, you would have additional responsibilities. And you can obviously expand those over time as you get more experience and get closer to the team. You can also get involved with dispensing medicine. There's a separate license or like a small part of the course that you have to do before you can do that, but it's not a huge extension of it. So if you do get that, then you can also participate in dispensing medicine. And that's also like a lot of great knowledge to have, because if any pre-health track, you're going to need to have knowledge about different medications and pharmaceuticals. And so I think it helps you get that understanding as well. So, and one thing I would mention at this time is like, just to emphasize how like you get to see a diverse group of patients with as a CNA, like the other clinical positions that have been talked about. So for example, I remember, so I used to work night shifts at the hospice center. So I used to see patients like ranging from like people who were suffering from hepatitis B to end stage cancer, to like, I also once had a child, like I think it was, she was only a few months old and she came in for hydroencephaly. And you get to see a broad range of these patients, you get to take care of them. And I think it's very meaningful and valuable experience in that way. So if you want to get started with being a CNA, I think the good thing about that is the certification process is typically shorter than a lot of the other programs. So if you look around some of the private agencies, you can get the license within 4 to 6 weeks. If you put in more hours initially, and then you can also, some programs are about 8 weeks long. There's a theory part, the taking the course where you learn all the knowledge, and then there's also a practical part. So because when you do take the licensing exam for a specific state, you need to complete the theory exam and also the practical. So like I think there are about 25 skills that they teach you during the CNA course, and then they ask for like 5 random ones on the day of the licensing exam. So that's how it works. And I'm also open to answering more questions about that if you have any. And then about finding a job, as I was saying, if you have a license, it's actually pretty attractive, I guess, for these employers, and it's pretty easy to find a job. You can apply directly through websites. You can also go to specific hospice centers or hospitals. They're always looking for them. And because of like, I think nurse aides, you can have very flexible hours. So if you want to work just on the weekends, you can do that. If you want to work 2 or 3 4-hour shifts, you can work that. So that's always something that can be worked around. So that's another benefit of getting this license. So that's a synopsis of what a CNA license can do.
Okay, and our last position we're going to talk about is medical assistant. And this is a very nuanced position, I would say too. There's a lot of different skills involved, different roles involved, different ways to become one as well. So medical assistants usually work directly under and alongside providers. This provider can be physician, PA, nurse. It's pretty diverse. and they're cross-trained in clinical and administrative duties. And they're kind of like a patient liaison, have a ton of patient interaction. And one cool thing about medical assistants is that many opportunities provide on-the-job training, which is really cool too. So the responsibilities include clinical and administrative, like I said. So some clinical skills and responsibilities include taking patient histories, phlebotomy, which is like blood draws and things like that, taking vitals, injections. These injections can be intramuscular, like a flu shot, or intradermal, like a TB test. And they can also do wound care. And in some orthopedic practice, they can do casting and removing casts and things like that. And as far as administrative duties, medical assistants are really concerned with clinic flow, scheduling, updating medical records, and in some clinics and practices even have a role in reception and taking phone calls and things like that. So in terms of getting started, it's kind of nuanced. So in Georgia, you don't have to be certified to work as a medical assistant. Just from my job search, I found that a lot of smaller clinics do not require you to be certified, and they'll train you on the job and things like that. Whereas sometimes hospital systems would prefer a certified medical assistant. So for those that don't necessarily require a certification, you can apply directly on job finder websites like Indeed, ZipRecruiter, things like that, with your resume and things of that nature. And typically will get a response because, like Sneh said, a lot of these healthcare positions, especially these kind of entry level, I would say, are in really high demand. So that's a good thing for all of us because there's a need for it. And then as far as certification programs go, medical assisting in itself is a career. So there are a lot of certification programs that if you just search medical assistant certification, these programs are going to be very intensive, like 9 months and more. So there's a few that are more tailored to students to get your certification. One local one is Medcare Health Cert, and I think a few peer mentors have gone through this one in the past. So this one is basically really clinical focused and clinical skills focused. And we can link their website as well. But basically there's like 20 or so clinicals you do. And at the end of it, you take your national exam to get like certified. So that's an in-person option. And usually I think it takes 3 months minimum. It can be more than that. It's super tailored to students, like on your own schedule. There's no timeline. Really cool program, really awesome lady who runs it. And then there's also advancedclinical.org, which I know a few. I've had a few friends go this route, and this is a totally online option. I would say one nuance with this option is when you're looking for a job, they might ask why your training is totally online. So you might have to be trained on the job for some of those in-person skills. So very nuanced role, and we'd be happy to answer any questions on that when we get there. Okay, so now we're going to go into our experiences a little bit because we all have very different ones, which is really cool. So my main clinical experience is as a physical therapy tech. So like I said, I'm pre-PA. So physical therapy technician counts as clinical hours for PA school. It doesn't necessarily count for pre-med or anything like that. But the main reason why I chose to be a PT tech is because I have a strong interest in going into orthopedics in the future. So being a physical therapy tech kind of let me see the after of orthopedic surgery and the practice as a whole. So I was really interested in that, really wanted to see what that was all about. I really love how in physical therapy, you see the same patients every week. So it was really cool to build these relationships with patients I was seeing every Tuesday, Thursday. And I really just loved going to work and loved getting to work with patients. And from all those interactions, like I wrote about them, and I'll surely use them one day to talk about in interviews and things like that. But I found it was really enriching for my, like medical knowledge and knowledge of orthopedics as a whole. But it really kind of, I became like a social butterfly with all the patients, and it really teaches you a lot on how to interact with patients. Some patients are in a ton of pain when they're doing physical therapy. Some are super excited to do physical therapy. So it really helped me kind of tailor their patient experience to whatever the patient was feeling, because I think this role is a super kind of sociable role, and was really helpful for developing those skills for me.
That was great. So my main clinical experience has been as a scribe in the emergency departments, and the reason why I chose it at first was I was broke, so I needed some money. But then also I really wanted to be like in a hospital setting, working intimately with doctors, talking to doctors, getting feedback on their experiences. And so I think like the most surprising thing that I learned outside of like being able to ask doctors lots of questions and observe different types of patient care is observing like hospital systems, especially in a place like an emergency department where things really need to run very efficiently and things move fast. And there are many holdups that stop patient care from happening as fast as they need to be happening. So that gave me a lot of insight into why I wanted to become a physician and what I want to do with my career in the healthcare field. So that's why I think it's really important to also just have an open mind when you're going into these clinical experiences, but also considering like what you want to get out of it, like what kind of setting you want to be in, what skills you want to maintain. Because as you could probably notice, like being a medical scribe is a little bit more passive on like the healthcare side. Like you're not like doing physical things, you're just doing the charting, but you can learn different things from that. Yeah. Yeah, so my main or first clinical experience was getting to work as a medical scribe and a medical assistant at a dermatology clinic in the Atlanta area. And for me, that was really cool because I had the opportunity to scribe with both physicians and physician assistants. And so for me, it was kind of a way to learn a little bit more about the role of a PA. I think at this point, this was the summer after my sophomore year. And I had just been home for a whole year. So I just wanted to have the opportunity to get to see a PA in action. So it was really cool and kind of got to affirm what I wanted to do. I kind of see scribing as more of an in-depth version of shadowing because you're getting to understand just how the provider thinks. I'm sure like Izzy can probably relate to that too. So I think that it's a really cool experience, really valuable. And then with this particular clinic, I was also able to take on a couple of medical assistant duties. So, you know, getting to have the opportunity to interact with the provider a little bit more was exciting. I could help them with wound care or assist them during a biopsy or even an excision of a melanoma, let's say. So I think getting to see that and then also a range of different diagnoses and different patient conditions was really cool for me. And just getting to have that hybrid role of like an MA and a scribe position. And then the other role that I also would want to highlight that I've taken on this year is working as an EMT with EAMS. So here we're volunteer EMTs and we serve the about 2-ish mile radius around Emory's campus. So that's Emory's campus and then kind of the surrounding communities like if you've seen Wesley Woods. And so you're getting to work with kind of a different population. And for me, I think that that was what was exciting was getting to engage with Emory directly. And so, and getting to respond to a bunch of different types of calls and calls that, you know, are like varying degrees of stressors and getting to also work with other Emory students. But yeah, so forces you to think on your feet a little bit. And I think I needed kind of a bit of a kick in that direction. So yeah, would recommend.
Yeah, and I can end with my experience as a CNA first. So I'll be honest, the reason that I got my license at the beginning was because of COVID. So it was my sophomore year, obviously, was online for all of us. So the only way to get into a clinical setting was to have some sort of license. So I thought that was the best time for me to get it because I also had a lot of time on my hand. And I think it ended up being a really good decision because not only could I get into a clinic at that time, but I was able to work as a CNA after when we got back. And I think the reason that I chose the hospice setting was I knew that I was kind of interested in oncology and wanted to work with that patient demographics. And so I wanted to work with people who were, you know, typically on the severe side of the illness and the ones that potentially have tried everything and it's, you know, to the point where like now they're essentially just trying to increase their quality of life before whatever happens. So I thought it would be a great eye-opening experience and a huge learning curve to understand what it's like to take care of patients who are suffering from that kind of illness. So I think I learned a lot about myself and about like, how to handle those situations. Definitely like loss is such a huge thing that I think anyone in the pre-health field is going to handle or tackle it to some extent. So I wanted to get some experience with that. And I think it really helped me learn a lot of gratitude in addition to just like the clinical skills that you learn with being on the position. So it was also great it was kind of like a microcosm of like how the team operates at a hospital. So that was also another great thing of having like a team of physicians, nurses, and nurse aides kind of working together to ultimately better patient care and make sure that the patient was happy at the end. So that was also another great thing to work in a team. And my team was also really it was amazing teams. I really enjoyed going to work every day, every weekend. And then yeah, the last thing I would mention is I also work now as an ABA therapy intern at Marcus Autism Center. So I now work with a different kind of population, wanted to see what it's like to work with children. And I think that's also been a pretty good experience. It's a very different experience than being at a hospice center, but I definitely have learned a lot about being patient and being and working with kids who have some kind of developmental disability. So yeah, definitely would love to talk more about it if you have specific questions.
Okay, so now we're gonna go into some questions. So if you want to unmute yourself and ask a question or anything like that, I see, Terrell, you already have a question, so feel free to unmute yourself, or if you want to put a question in the chat, also feel free.
So I was just wondering, I was actually a little surprised that you categorized shadowing and like clinical experiences as like the similar thing. I believe on the AMCAS, this is only for pre-meds, but I believe on the AMCAS, they're like two separate, like in the drop-down menu, they're like two separate choices. I was wondering if I at least my thought process was always like, shadowing is like something you're doing passively, you kind of just observe, whereas scribing, CNA, medical assistant, you're actually like hands-on dealing with patients, like talking to them. So I was wondering like what your thoughts were on that, or if they're interchangeable.
I definitely wouldn't say they're interchangeable. I think we categorize that like that just to show that there's a difference between paid versus volunteer, and then shadowing. You're still getting exposed to a clinical environment, clinical setting. The goal of shadowing, like being involved in other clinical experiences, is to see, is this, the profession for me, to enrich patient physician interactions, kind of observe everything. So they're definitely not interchangeable, but still involved exposure to a clinical setting. If anyone else wants to comment on that too.
Yeah, the way I like to put it in my appointments with people is that like shadowing is like supplemental to the rest of your clinical experience, because shadowing is a lot more versatile, and like you can like shadow a lot of different specialties, a lot of different PAs, whereas with clinical experience, typically you're in one setting for a while. So yeah.
And then one sort of quick question, doesn't really have anything to do with like any of this, but I was wondering if y'all knew the timeline on like the committee letter. I was trying to get a meeting with my PHA advisor, and I mean, I don't know if it's like always like that when I just log on, it happens to be, but I see like no meetings for the next 2 weeks. Just like, you guys have any like information about that?
I can chip in for this question. So I know it's pretty difficult. I think they're in high demand, so those appointment slots are filled up pretty quickly. But I think, and correct me if I'm wrong, but like I think they're posted every Monday, or every like 2 weeks, I guess. But it's posted on Mondays, and so like I would recommend like looking at that time. And if that doesn't work, and if it seems like you're constantly you can't get an appointment, I would just email your advisor, and I'm sure they would accommodate and find a meeting time.
And just quick follow-up, I don't know if y'all applied like this year, if you're waiting for next cycle, but what do you know what the like timeline on the committee letter is? I think there was like a couple like meetings you have to have first before you know, like they let you, they say like, oh yeah, we're gonna give you one.
Yeah, so the composite letter is due in January sometime. Let me like I can look up the dates. I don't say the wrong one. Let me see. It's also on the, if you go to the SharePoint, they have it's called Composite Letter Corner, and they have all, I'm sure they have all dates and everything that you need. Let me see.
Okay. All right, great. Thank you so much. Thanks, y'all. It was a good talk.
Thanks for coming.
All right, I see that there's a question in the chat, so I can go ahead and take that. So it says, for EMS, would you recommend getting the certificate at Emory or through another program over the summer? So I think that that is just up to personal preference. I will say, I guess going off of my experience, I worked with Emory. I wanted to work with Emory EMS, and so for me, I wanted to do the course through them and get to learn a little bit more about that system. And it fit in well with my classes and everything, so I didn't have a huge problem scheduling it. And I also wanted to keep my summers free to, you know, have my scribe and NA job. So again, that was just kind of up to personal preference, but I know that some people prefer to do it over the summer. The way that Emory's class works currently is it's Monday 6 to 10, Wednesday 6 to 10, and every other Saturday from 9 to 5. So I will say if you do the EMT course through Emory, it is a bit of a time commitment and kind of something to keep in mind, especially if you have, you know, extracurriculars or research or other things to kind of manage with that schedule. And then as a provider with Emory EMS, if that is something that you're interested in, you will be working, you know, 2 shifts a month or 3 while you're in the process of field training. So just something to kind of keep in mind with the time commitment, but that is up to preference. Mine was just to do it during the school year.
I have another question in the chat. So how are you able to balance school classes with a scribe schedule? How many hours a week do you have to work? So where I work, you have to work at least 16 hours a week. For me, it's a little bit different now that I'm a chief scribe. I kind of split my time between like admin work and the clinic. But before, when I was purely working in the clinic, balancing classes, I did have to sacrifice some things. Like I did have to decide, okay, I'm gonna do one less club this year, and I'm gonna dedicate more of my time to this and that. Just kind of like redistributing myself and like knowing myself as a student and how much time I need to study. Because at the time I know I was in a lot of like pre-med prereqs, like life was pretty rough. So just like knowing myself and prioritizing like still my mental health and like knowing what I can do, that's how I was able to balance everything.
I see one question about medical assisting or nursing assistant positions, recommending how to get opportunities without a certification, as the only job listing shown on jobs websites need certification. So I've been looking into this recently, specifically for medical assisting. You really got to dig for them. They are out there that offer on the job training that will say in the description. Sometimes they'll say certification preferred. So I always just say apply. The worst case scenario is you don't get the job. And if you just apply and they see your resume, even if you don't have a certification, maybe, you know, they'll see something else they like and they know that you're trainable, coachable, teachable, things like that. I don't know for nursing assisting if you can do that without a certification. I think Sneh, you can answer that question, but I know for medical assisting, you just have to find the positions that don't require it.
Yeah, I think I would say the exact same thing. And for nursing assistant too, there are programs that are there that would train you on the spot. So what I would say is like even for the programs that say that it requires a license, I would still go ahead and like not just apply, but also email the person that's the contact person. I think they typically, if you email them and express your interest in the position, and if you're like, I'll work even I'll even volunteer for like a semester or like, like a few months. And like, if that's how you can get started, that's always nice. So once you have an in, then they would like to keep you and then they can hire you and stuff. So it's always nice to, just give it a shot, and see what happens. But they're pretty open, especially I think more for CNA than MA, in my opinion, because I think MA people get to do more because the training is more intensive. So, you can apply for both of those kind of things and see what happens. Any more questions? Okay, so if we'll stay back, we'll stay here for obviously, for 10 more minutes. So if you don't have any more questions, thank you for coming. But oh, there's something in the chat. Oh, Brooke, do you have any
Oh,
answer?
yeah. So this is gonna be, this being recorded and it's gonna be posted to the PHA YouTube. So if you just literally look up Emory PHA on YouTube, there's a whole playlist of similar lectures just like this. So this will be posted there. And it's also a really great resource if you can't attend other events. I know there's a whole lecture on scribing, on research. So really, really great resource to look into. And it'll probably be posted. I don't know the exact timeline, but probably I would say after Thanksgiving around that timeline. I'm not positive, but it'll be up soon.
So to answer your question on Tara, at least for scribing, you're not required to be in school. And if anything, it's better if you're not in school because then you can work more consistently, and have better availability for when you're applying, more flexibility to what kind of sites you can apply to. So
I would say pretty much same for all these clinical positions. It actually would be better if you're not in school. You can probably put in more time, work normal business hours, and yeah, you can also mix and match. You can work part-time as a nursing assistant, part-time as a scribe, and get different kind of experiences. So definitely know people who do that during their gap years, in addition to just, clinical research coordinators and stuff like that. That's more common. Yeah. Well, do any of you all have any specific questions or anything that you would like for us to go over?
And the questions don't even have to be clinical opportunities related. If you have any questions, any burning questions you've been trying to ask your like main PHA advisor but couldn't get an appointment, we can try and help. Literally anything. I'm gonna go ahead and end the recording. Also, Gary, unless you have a question.